But what we want is to make sure that we have reach, use the private sector to get us out into areas that might have been difficult for us. And so with our combined efforts, government and private sector, that we'll have a broader reach, be more efficient, and we'll serve as many persons as possible in the fastest possible time. For the people in the iCare program that we have, it's a two-stage process. So first we will be distributing the vouchers to screen to make sure that the person will have some kind of, if they have a problem, then if it's a problem that we can fix with a spectacle, then we want to make sure that we give them a second voucher, which would then be $15,000 that would contribute to their spectacle. We are not covering the full cost, because if the spectacles cost, I don't know, $20,000, $30,000, we are only contributing $15,000 to that cost, right? So we want to give them that second voucher. And when you do the screening, if you find that they have other types of problems that cannot be rectified with the spectacles, then if you identify those problems for us, whether it's cataract or something else, then we can then put them through a different program. With the HPV one, I think Dr. Lal spoke to that as well. We want to make sure that 70% of women, at least we cover that. If we can go higher, that would be great. And we're targeting women between the ages of 21 to 65. So if we can go higher than what the WHO is asking for and get to 90%, that's fine. And again, with those providers that we are working with, we want to have the same kind of collaboration. If we find that there's any difficulty, let us know.
Both programs are very beneficial, and they're going to benefit a lot of Guyanese people who really require that assistance and need the assistance also, especially when it comes to eye testing and having spectacles, and then for women to prevent cervical cancer. So I think, generally speaking, we can agree that the programs are very useful and insightful, and I think it's new. It's something that has never been done before, and I think it's something that sets us at a different level compared to the other countries in South America, the region, I'd say probably the world. So with that being said, the Government of Guyana programs, both for the cervical cancer and for the eye care, they're a little bit different, and so we have different groups depending on what you're going to be providing in terms of services. For the eye care, it's pretty simple. We're going to share the vouchers out to those individuals who are eligible, which I believe is 18 years and below and 65 years and older in terms of age. Then you'll be able to, a person may be able to take that voucher to a testing site, get your eyes tested. If the testing site believes that they need prescription glasses, they come back, they get a voucher to do the spectacles, which is $15,000, and they're given that. It's pretty simple. The only thing we're asking from you is that you provide us with a limited amount of data, which we've tried to make very digital. So for the case of the cervical cancer, Dr. Lal would have shared with you an Excel template so that you can fill that out. You can choose to submit that to us in Excel by email, or you can choose to do a Google Sheet and then share it access to the Ministry of Health. The other part is the two forms. Now, when a person comes to you to get a voucher or submits a voucher to do the eye testing, you would enter onto a Google form the relevant data that we're asking for. It's a few things, nothing very intrinsic. And then, of course, when they come back to get a spectacle, it's the same thing. We're using that for two purposes. One, epidemiological, to understand what's happening in the population, what the situation might be. And of course, it helps with accountability of the vouchers. We only ask that the service providers assist us also, not only to provide the service to the public, but also help us in terms of having that process be accountable and transparent.